Dr. Rubenstein, let's talk a little bit about cosmetic dentistry, and in specifically there, let's talk a little bit about. I have a question: veneers and lumineers. Um, what's the difference there, really? To me, they both look like clip-on fingernails, tooth nails. Give us some insight of there. People run around on television. It's like lumineers, lumineers, and so much better than veneers. What's the difference there? What are we talking about?
Well, I don't know if I can give you an opinion on that. Lumineer it's actually a trademark from a company that makes a particular type of porcelain and porcelain veneer, where they claim, I've taken their course, though I haven't done any, that you don't have to prep the tooth. In other words, you don't have to grind down any part of the tooth, and you can put the sort of like a fake fingernail, except it's a fake tooth, over the top of the tooth, and it'll be just fine. I think in certain situations, it's certainly possible to do that, whether you need a veneer from the Lumineer company or you need a veneer from your own laboratory is really a question of where you want to deal with it, because I think, other than name brand, in today's day and age, most credible labs can make very thin veneers that you may not need to do much touching of the tooth at all. But every person is different as to what you're trying to accomplish, and I can't say that you can't have a tooth that you can't just put something over. It's just a question of how much space you have to do it, and will it look bulky, or can you get away with it? But the answer is veneers are can be very thin, inconsequential in thickness. Sometimes you need actually a thicker one, even if you're not cutting the whole tooth down for crown. But essentially, once you put it on, if you don't like what you got, you have to grind it off. So at one point or another, you're altering that tooth somewhere. If you like what you got, hopefully you never have to alter it again. But we'll find out years down the line.
So basically, for us patients, lumineer, veneer, we shouldn't even bother about it, because the dentist will kind of like, it's almost like you go to lab A or to lab B. What do we know? What do we care? In the end, I need to look good. I need to be what it is. And the dentist will use what it used. And what you're saying is a lumineer is on an average, or used to be at least when it came out, a little thinner, so a little bit less grinding has to be done. And that's only if the tooth is already in more or less the shape you want it to be. If there's a crooked tooth and you want to make it more straight with a veneer, probably have to do some grinding anyway, and a veneer has to be thicker maybe on one side than on another one. It needs to be fitted on it. And also you say that these days all labs already make very, very thin veneers anyway, which that one company in this case would be calling Lumineer. So for all purpose, for us patients, it's just brand A, brand B. And since you're choosing all the brands from the Novocaine, from whatever it is you use, and we're not questioning it because that's why we come to you in the first place, we shouldn't concern ourselves with it. We should just go, doc, I want to have my teeth a little brighter, a little wider, a little... And probably you even advise there what fits a person, almost like a fashion designer who might tell me, Helmut, you're getting too fat. You shouldn't wear striped shirts anymore. You should be wearing linear one or whatever. He might do that. And I think you do that too when it comes to when a person comes in and say, I want to change my look, right?
Well, I think that's essentially it. Now, most of the time is if somebody comes to me with some cosmetic or aesthetic concern, we usually sit down and discuss all the options, and I usually will take models and photos and discuss it with my laboratory, and perhaps have them wax up what we're looking to do, and discuss what the treatment options are. I mean, I think it's if you're sticking to one theme that you're going to make one thing fit all, well, I guess that's a wonder bra. But if you think that people aren't different and their desires aren't different, then the answer is you're going to have to really discuss it with sort of specialists who make these things and I preparing it and what the patient's wants are. It's sort of like if I do bleaching or whitening and, most people tell you, well, I really want them to be whiter, but I don't want them to look like toilet bowls. But the answer is they may get brighter. The question is, you may have that they're not so satisfied because underneath what they really wanted was toilet bowls. And I think you have to be honest with them as to what you can and can't achieve. And I think sometimes with veneers, you can certainly achieve a heck of a lot more. How you're going to do it is a question of how the patient, what they really want. And you can explore those options prior to them doing it. So
beautiful. I think you answered the question very well about lumineers and veneers, which you should not worry about. It's really basically the same, just different brands. Now, I also heard that veneers and lumineers, veneers, let's just use the word veneers from now on for all of this, are quite often used for what's called instant orthodontics, meaning basically you might have all kinds of crooked teeth and maybe you're 20 or 30 years old, whatever, or older, and you might not want to wear braces for a half a year, or whatever it might take, 2 years, maybe sometimes even, and you go, doc, fix them, grind them, put the stuff on it. It may cost more money, it may be a little bit more invasive, but like, hey, I want to look good tomorrow. You understand? Tomorrow meaning, a few weeks down the road or whatever. But how does that work out? Pretty good? Is it really like something which is...
Well, yeah, I think that the answer is you could probably do pretty much anything if you wanted to with somebody who would want to do that. I mean, they would have to understand that you're going to do a fair amount of grinding at times in order to create situations where you can fit the veneers in and line them up. Sometimes the tooth might be a little bit thicker or a little bit thinner because of front to back or, cheek to tongue positions of the teeth or whether they're cockeyed. I've had people who have spacing between their teeth and they're not going to do orthodontics and they're getting married in, I don't know, 2 weeks, a month, whatever it turns out to be, and they want to close those spaces.
Sure.
And the answer is you can do it, and you can do it relatively fast. You could, I guess, in certain circumstances, I guess the fastest veneers I ever did was I paired 10 uppers and 8 lowers on a Wednesday, and we put them in on a Friday. So if your lab is cooperative and the patient is willing to pay the freight, the answer is you can pretty much do it overnight. But
anyway,
as far as is it orthodontics, yes, you can do it. I've done it several times, and if they can hold very stably without having to worry about post-retention movement at times. So
yeah,
it's very good.
So those veneers do hold on it, as long as you don't go around and then trying to chew bones like a crazy and whatever it is, and chew eyes, all the type of things you shouldn't do with your natural teeth anyway. They're there, they hold there, they don't fall off. You can eat, you can bite, you can eat a spare rib, you can eat an apple, no problem, right?
The answer is yes. I mean, I would say I've probably been doing veneers since about 1983 or somewhere in that neighborhood in porcelain. And I still see the person who I did first. And except for the fact that the porcelains are livelier, I probably would have changed, probably with laser, the position of her gums and stuff like that. She still has the same original 10 veneers we did. And everything looks, well, to me, I would aesthetically change it, but she's been happier than can be. And every now and then somebody pops one or breaks one. It hasn't happened that often, but the answer is, I think if you prepare them correctly, they can go on for years and years. It's very hard to estimate what somebody's going to do. I mean, do people break their own teeth? Yes. So veneer, if you pull off a bottle top, could be the end. So
Well, all right. Wonderful, wonderful. Thank you very much again for explaining it, so down to earth, so kind of like real, without any hype. Appreciate that, Dr. Rubenstein.
You're quite welcome.